health issues and low libido. Okay, so I just threw out a couple of things here, but things like diabetes, Parkinson's, MS, they can all cause a low libido, sort of directly can cause a low libido. High blood pressure can cause a low libido. Things like taking beta blockers can cause a low libido. And here's a little my story. I don't talk about myself that often, but my story is I was born with heart issues, and for years they say, "Oh, we want to put you on beta blockers." And I'm like, well, what are the side effects? What are the potential side effects? And they go, well, it could cause some sexual difficulty, could cause some erectile dysfunction. And so I'm like, well, that's a hard no. I did say that to my doctor. But anyway, so no, in fact, I started labeling beta blockers as boner blockers, and I was never going to do it. Well, then I had heart issues where my heart was doing weird rhythm issues. It was very uncomfortable. In fact, very uncomfortable for me. It was affecting my sex life anyway at the time. So I'm like, just make it stop. So I got on the beta blockers, and turns out they didn't affect my sex life at all. So these beta blockers, what I called boner blockers, didn't affect me at all. I didn't notice anything. I've been on them for 13 years now. I've noticed nothing negative from the beta blockers. So whatever. So my story is sometimes medications can cause things. Sometimes even when they say they can cause things, they don't cause things. So find out. What other things as far as health issues and low libido? Chronic pain. Clearly because you're feeling pain, and maybe then you think that you're not interested in sex, although sex can actually help with pain. So there's something going on there as well. Cancer can lower libido. Cancer diagnosis, a cancer diagnosis can lower libido because of the stress. Scars, skin issues, weight gain, that can all lower, we call these health issues. They wouldn't have to be health issues, but if you have a scar from a operation, that might lower your libido because you don't feel as attractive, possibly. Although maybe your partner finds you more attractive because scars are sexy. Who knows? Find out. It could be the idea of feeling more like a patient than a romantic partner. If your partner is taking care of you and helping you do certain things in life, like get up, go to the bathroom, who knows? It could be more of a caretaker relationship. That might not be sexy. You can see how that might not be. And if you're going through that right now, you might be the one being cared for and might feel that they see you a certain way that they don't. Talk about this with them. And if you're the caretaker, you might be viewing them as more of a child relationship because you're taking care of them, right? Or more of that caretaker relationship and not as the sexual partner. Or you don't, but you think that maybe they then see you, right? It's the whole mind reading. I think that you think that you think that I think, blah, blah, blah. Have this talk. Have that sex talk when you're going through any health issue. Have the sex talk, or talk about sex as far as what you can and can't do with your doctor. When am I able to have sex? And what is that? What can I expect it to be like? And what about these medications? Or are there interactions with the medications? And are there things that I can do in my life so I can get off of medication so I can have sex or have it more easily, or blah, 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 whatever. Or if I take Viagra and so on, if I take this or don't take that, talk with your doctor about sex. They have heard it before. I have health issues. I've talked about it all the time. When can I do it? How can I do it? What about this? Everything. When can I be on top? When can I be on the bottom? Who cares? They're adults. Ask them. And just as a bottom line, anything that affects health can affect libido because it's a kind of stress. Illness is stressful. Being infirm or being less than is stressful. Maybe our libido is lower. Our libido is lower because we're thinking about death. Death isn't usually a turn on for people. We're thinking about our own mortality. We're thinking about being less than we were. We're thinking about maybe that we are or we consider ourselves being less. I'm now less capable than I was in the past. And maybe that means I'm less attractive to my partner. Again, mind reading. Uh, all of that could be viewed as not sexy as far as in our own mind and as far as maybe in our partner's mind, but maybe in only in the mind reading in our partner's mind. And maybe they even see us as sexier because of the heroic way we went through a health issue, right? You have some health issues, some life experiences, some courageous, heroic things you've gone through. You've gone through the hero's journey. Maybe that's sexier. And you don't know unless you have that conversation. So have the sex time, the sex talk with your partner about sexy time, and kind of see, like, I'm feeling this. Do you feel this? I'm feeling this. Do you feel that? What do you feel? Getting on the same page, playing with your cards face up with your partner, because stress is stress wherever it comes from, health or otherwise. Wherever we are in life, wherever you are in life, whatever health issues you're going through, whatever health issues you've been through, you still deserve to be a sexual being and to be in touch with your sexuality, which is also kind of like a spirituality. Sex is like the spirituality of the body, where we feel spiritual through the body. We feel those sensations and wonderful chemicals. You still have a right to feel that however you look, whatever your health situation. Reach out to me if you have any questions. Maybe put below what's worked for you when you've been going through a health issue. And then, yeah, reach out to me if you want that personal assistance. Believe me, I know what it's like as far as going through a health issue and wanting to have a fulfilling sex life. Otherwise, I will see you on the next video.